Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. Our apologies for the brief delay. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I get to today's cases, I wanted to update you on our COVID-19 vaccine distribution. As of last night, 394 healthcare workers had received their first dose of vaccine. I know that many people want to be vaccinated immediately, and that is a good thing. We are moving quickly to make the doses we receive available to those who are eligible, and we will continue to do that going forward. There are about 4.4 million Albertans. It will take time to get enough vaccine to offer to everyone who wants it. Please be patient while we all wait for our turn, and be supportive of those who are in the initial groups to be immunized. We are starting with critical health care and long-term care workers, as well as those living in continuing care, to save lives and protect our healthcare system for all Albertans. These are people who are most at risk and who are putting themselves in harm's way every day. I know there have been a few issues along the way with some in these groups not having received calls, and some not in these groups who have inadvertently been included on the lists, particularly those in ICU or respiratory therapists. Given how quickly this has been moving, issues like this are not unexpected. I ask healthcare workers to talk to their managers if they have received a call when they are not part of these groups, or if they haven't received a call when they are part of them. There will eventually be enough vaccine for everyone who wants it. It will just take a little time. Turning to today's case numbers. Over the last 24 hours, we have identified 1,571 new cases of COVID-19 in Alberta and completed about 19,800 more tests. This means our positivity rate currently stands at about 7.9%. There are now 763 people in hospital, including 138 who have been admitted to the ICU. Sadly, I must announce that 30 deaths were reported to us in the last 24 hours. This is a heartbreaking figure. While these deaths did not all occur yesterday, this is the highest figure that I have had the sad task of reporting. If anyone still needs reminding of the seriousness of this virus, of the importance of the restrictions that are currently in place, and the importance of doing everything possible to limit our interactions and break the chains of transmission, this is it. There are now 790 Albertans who have died as a result of COVID-19. The death of a friend or family member is tragic at any time, but I know that during the holidays, we can feel these losses and our loved ones' absences more than ever. I extend my heartfelt sympathies to everyone mourning a loss today from COVID-19 or from any other cause. There are currently active alerts or outbreaks in 450 schools, or about 19% of schools in the province. Currently, these schools have a combined total of 1,966 cases. This number includes 126 schools on the watch list. With Hanukkah wrapping up tomorrow and Christmas and Kwanzaa only a week away, I want to talk today about the holidays. We are 1 week away from the start of a few statutory holidays for all Albertans, regardless of faith or background. I know that holiday plans are top of mind for many people, and I want to reiterate my message from earlier this month. This year, we can and must celebrate differently. Holiday gatherings with people outside of your household are not only against the restrictions that are in place, they are also the wrong thing to do right now. I know that Albertans want to do the right thing. The safest way to celebrate this year is in person with only your own household, or with your designated 2 close contacts if you live alone. Celebrations with others should be virtual. I know Albertans will do the right thing, but for some, it may seem like the right thing to do is bend the rules, not out of malice, but perhaps out of compassion. I want to be clear that the compassionate choice is to follow the rules. It may not seem like a big deal to get together with your extended family or group of friends. If you all feel fine, you may think that there is no risk of catching COVID-19 or passing it on to others. But that is simply wrong. We have seen time and time again examples of people attending a gathering with either mild symptoms like headaches or a stuffy nose that they didn't connect with COVID-19, or when they were in the day or two before their symptoms started, when they were infectious but didn't know it. The result has been one case spreading to many. That is how cases rise and outbreaks start. These orders are not recommendations. They are legal restrictions, and for them to be effective, we need everyone to do their part. Thank you to all those who are changing plans and finding joy in different ways this year. Last week, I asked Albertans to share the unique ways they're embracing the spirit of the season and spreading joy. Once again, I am impressed by the generosity of Albertans, and I want to share a few examples that can help to inspire more acts of kindness. Project Joy, an organization founded here in Alberta, is collecting unused smartphones and tablets and providing them to continuing care facilities to help isolated seniors stay in touch with their families. I've also heard many employers have replaced traditional work Christmas parties with care packages and holiday treats delivered straight to people's homes. The Elk Island Regional Honor Choir Association has been practicing on Zoom for many months, so they decided to take their annual winter concert digital as well. I want to thank all these groups and individuals for finding different ways to make the season joyful. This has been a challenging year, and I know this holiday season will be difficult for many people. This is a particularly challenging time for those living and working in continuing care. To help lift their spirits this holiday season and show how much they matter to us all, I encourage everyone to send holiday cards, letters, art, or other shows of support to continuing care residents and staff in your community. This small act of giving can go a long way. It will help spread joy and encouragement during the holiday season and remind our most vulnerable that they are not alone, that Albertans care and are thinking about them, and that we are all in this together. Please show your support to a continuing care facility that's near you. If you don't know where to find them, we have posted a holiday article to help. You can find it at alberta.ca/COVID holiday info, and you'll also find a link where you can search for a facility near you. Also remember that each facility may have a gift policy, so if you're thinking of sending larger items or perishables, please check with operators first. We are still all in this together, so let's be wise, compassionate, and protect each other. Thank you, and I'm happy to take questions.
Now, operator, could you put through the first caller, please?
Our first caller is Jeff Slack with 660 News. Go ahead, Jeff.
Hi, Dr. Hinshaw. I've seen reports that the Pfizer vaccine vials may hold extra doses, and provinces are able to squeeze out additional doses. Is this something that's happening here, and how many more vaccines would this create?
Each Pfizer vial typically contains 5 doses, and of course, when creating these vials, there is enough put in the vials to make sure that there's a guaranteed 5 doses in each vial. If you have a very skilled immunization administrator who's able to withdraw exactly the amount needed and no more, it is possible that some vials may be able to provide enough for 6 doses of vaccine. And that is something that our immunizers are looking at, and when possible, that, of course, we will be able to provide those extra doses whenever, again, that vial is handled in such a way to make that last dose available. But again, the reason that there is a little extra in each vial is to make sure that we can guarantee those 5 doses. And so that's what we are planning on, with that extra dose, again, being made available when it's possible. And hopefully that would, again, increase the number of people that we can immunize with our current shipment.
Operator, can you put through the next question, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. I have a question about these anti-lockdown, anti-mask rallies that have been happening with increasing frequency. How dangerous do you think these events are, both in terms of spreading misinformation, but also just as a mass gathering on its own in terms of people getting infected at them? And what would you like to see happen as far as enforcing the public health orders against those large gatherings when it comes to these events?
I think it's, as I've said before, understandable for people to feel angry or sad. The common stages of, the well-known described stages of grief include things like anger, sadness, bargaining, denial, before we get to a stage of acceptance. And all of those kinds of emotions are completely natural to feel. The problem is, of course, when people are disregarding the evidence and as I mentioned just today, we had 30 deaths reported to us in just 24 hours. And so I guess what I would say to people who are engaging in those activities is it's not just that they're accepting risk for themselves, they're actually engaging in things that are risky for the people around them and for their communities. And while I completely understand the frustration with all of the things that we have all lost this year, it is COVID-19 that is the enemy, and that is what we all need to be focused on combating. And so with respect to how I would want these kinds of demonstrations to be addressed, there certainly is a right to be able to have people's perspectives and voices heard. That is important. And at the same time, it is also important that when people are doing that, they not put others at risk. And we do have a document with respect to guidance around demonstrations and marches and rallies. So what I would want to see happen is that the guidance be followed in those rallies where people are showing their opinion and sharing some of those feelings of frustration, but that they do it in a way that doesn't put others at risk.
Operator, could you put through the next caller, please?
Next is Audrey Naveau with Radio Canada. Go ahead, Audrey.
Hi, Dr. Hinshaw. There's a couple of pictures from a town hall you participated in last night that are circulating on social media. We see that you're wearing a mask at your desk, but Ministers Tracy Allard, Casey Madhu, and Premier Jason Kenney are not, while they are, though, sitting far apart. However, this seems to contravene the provincial mask bylaw. I want to know, did you tell them to wear a mask or not? And if not, is it because you were not comfortable? And what kind of message do you think this sends to the population of Alberta?
The provincial mask regulation or requirement is that people wear a mask while in indoor public places or workspaces, unless a series of exemptions or conditions are met. One of those is that if someone is at a workstation 2 meters distant from all others, that they may remove their mask temporarily, as I do when I'm speaking at the podium. I do typically, when I'm in a meeting space, keep my mask on at all times, just because that's the easiest thing for me to do. And of course, it's important that all of us are considering our actions, but at the same time, that rule was set to be able to facilitate people temporarily removing a mask, perhaps when they're speaking, again, when they're making sure they're distanced from all others.
Operator, could you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. This will be a wide-scale vaccination campaign. Can you speak to what type of tracking the province will be doing as vaccines get distributed across the province, as in how many and where vaccines end up, whether there will be real-time tracking of how many vaccines are available in the province at a given time, that type of thing? And do we have the computer systems in place for this type of tracking?
We have an excellent vaccination tracking system that has been provincial for many years. We have the advantage in Alberta of having an integrated health system for the delivery of those vaccines, and we have a highly skilled team that works for the ministry at our provincial vaccine depot who are in charge of coordinating and making sure that we know at any time where doses are. Many years ago, we also put in Alberta vaccine inventory management system that we can utilize to very good effect now with this new the combinations of different vaccines we anticipate will be available over time. So we are very well positioned to be able to track all of that information and to be able to make sure that we know at any given time exactly how many doses of which lots and which types of vaccine are present in any location in Alberta.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please?
Next is Nicole Weisberg with CTV. Go ahead, Nicole.
Thanks for taking my question, Dr. Hinshaw. I was wondering if you could give us an update on the province's latest talks with the NHL when it comes to what's going on with the Oilers and the Flames and whether they're able to play here in Canada or whether they have to play in the States.
We have been in discussion with our local NHL teams on an ongoing basis and making sure that any of the training activities that happen under appropriate safety protocols. With respect to gameplay, that has not been determined. And so at this point, we're really focused on making sure that training activities, again, are done safely and they're done in a way that doesn't put others at risk. And as I said, when I was asked this question earlier this week about the World Juniors, recognizing that there can be a feeling of frustration where some individuals are able to train or play and others are not, that my primary consideration is making sure that public safety is held in the utmost importance and that all of the protocols are being followed to make sure that that level of safety is maintained, and that there have been some exemptions granted to allow, again, that training to continue.
Operator, could you put through the second last question, please?
Lauren Boothby with the Edmonton Journal. Go ahead, Lauren.
Hi, Dr. Hinshaw. Holidays in particular are a time where a lot of people want to attend a religious service. Right now, we're permitting 15% capacity, I believe, which could still mean a lot of people in one space, particularly in a large facility. Other provinces like BC don't allow any religious gatherings. Others only allow drive-ins. I believe Saskatchewan does that. Ontario, I think, maximum of 10 people. Do you feel like it's still the right decision to allow churches and other religious facilities to be open right now, heading into the holidays, despite this being a place outbreaks have happened before? And to be sure, freedom of religion is a fundamental freedom of Canada, but we also have freedom of association, and no one can really exercise that freedom right now.
We have, throughout the course of the pandemic, met with spiritual leaders, faith leaders across the province regularly and made sure that we had those lines of dialogue, that we were able to provide information that was necessary to them to care for the people in their faith communities, as well as care for those in their larger communities. And we have seen, as you say, there have been a few outbreaks that have happened in faith gatherings. For the most part, though, the vast majority of those kinds of faith communities have responded to the call. Many have actually gone to online services. Others have moved to the drive-in type service. And there are requirements that are in place, not just the 15%, but requirements on distancing, requirements on masking, and on making sure that anyone who is symptomatic or potentially a close contact with COVID does not attend. And so the combination of all of those elements together, along with that 15% cap and the ongoing dialogue we've had, is what we have gone forward with in Alberta as the way to mitigate the risk of gathering. But again, I would emphasize that our recommendation is that any who are considering bringing people together for religious reasons, I recognize that this is an important occasion, important holiday for many, but that it be done in the way that minimizes in-person contact, and that if some locations are choosing to have that in-person attendance, that all of those other measures be followed very strictly to make sure that the safety of their congregations, as well as the safety of their communities, is paramount.
Operator, could you put through the final question, please?
Our final question is from Dean Bennett with the Canadian Press. Go ahead, Dean.
Thanks. Dr. Hinshaw, now that we're ramping up the vaccinations, what can you tell me? What are you learning about the challenges that you'll be facing doing the vaccination? Specifically, is there any concern that some of it might get wasted? So, for example, if someone doesn't show up for their vaccination. Also, you mentioned off the top you've asked for patience. That makes me wonder: is AHS getting swamped with people seeking to get the vaccination right now?
I'm not sure about Alberta Health Services. We're certainly hearing from many groups who are eager to be in line for receiving the vaccine. And as I said earlier this week, I recognize the value that many different occupational groups provide to our society and the fact that vaccine will benefit many people, and we want to be able to offer it to as many as possible as soon as possible. But the patience I'm asking for is because the shipments that we're receiving, the supplies that we're receiving, are only coming in these small quantities per week, so we can only offer to so many people at a time, and we know that our first priority is on those who are at the highest risk of severe outcomes and those who care for them. And it's only once we're completing those groups identified in that first phase that we'll be able to move into some of those other areas, and again, those decisions have not yet been made. And you'd asked about lessons learned. You know, I think that, again, back to a point I made earlier, having a single provincial health authority has been extremely helpful in terms of coordinating the rollout, and I want to commend Alberta Health Services for the flexibility they've shown with shipments arriving at slightly different times than anticipated, and I think that those on the front line have done a tremendous job at being flexible and meeting the need to accelerate the offer of immunization and doing so in a way that's safe and appropriate. So I think, again, there's lots of good news stories that have come out of this last week with respect to how hard people have been working to offer this vaccine to those who are in that priority group.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe evening.